All right, cough and common cold. So antitussives, the biggest antitussive or most effective antitussive is codeine, who it is an opioid, which means what? It's addictive. It's narcotic. It's going to help with pain. Okay. So that's great that it's going to help us feel better, but I would want to be very careful in administering it because opioids are going to cause respiratory depression. Okay. So I would want to monitor their respiratory rate, their cognition level. Yes. If it has codeine, I don't know. I haven't heard of four. I've heard three. Um, but that probably if it has codeine, they don't in my I don't think they have that a whole lot anymore. They don't mix those two. They mix codeine with a antihistamine. Yeah, I think it's not as common of a thing anymore, but probably yes. Um, so this is going to suppress the cough by acting on our CNS, and it works great. And people are happy because coughing doesn't feel good, right? So especially if somebody has like a really deep cough and they've been continuously coughing, and you know how that hurts, like it even hurts to breathe because you cough so much. This is helpful to them because it's stopping the cough, which is giving them a rest, but also helping with pain. But their breathing was already affected, right? So just use this cautiously. They're going to have the same effects as they would if they were taking this like a opioid. So constipation is going to be a big side effect. Dizziness, I want to make sure to tell them they don't need to drive while they're taking this or be responsible for making decisions. Other things, just as like in a little aside, and it probably wouldn't be something you encounter, but like if I was administering this to somebody and they were getting ready to go down for a procedure, I would need to have them sign a consent before I give them this. I'm not going to drug people and then tell them to sign consents for me. Okay. So that's just a little side note. It does have a potential for abuse. So especially if somebody like is a recovering addict or they're actively an addict, I would want to, especially if they're recovering, make sure they were aware because most of the time they have to avoid that forever. Okay. And we would give them something, an alternative. We'll call it drowsiness, dizziness. So they're going to be at risk for falls, injury. Um, Make sure to use cautiously in those in older adults, children, people who already have respiratory depression, head trauma, if they have kidney renal dysfunction, or if they are actively using alcohol, because that's just going to exacerbate that respiratory depression. Um, I think I've already talked about that. Um, for uh, other antitussives, these are non-opioid. An example of this is dextromorphan. This is used to suppress coughs. It can reduce pain when combined with an opioid. It is going to work similarly. And then the effects are going to be similar as well. Nausea, dizziness, sedation, um, and it can cause blood pressure issues. I'm going to double check that fever statement, but it can cause blood pressure issues if used within 2 weeks of an MAOI. Okay, and those are just different types of antidepressants. And I think I've already said this. Many things cause issues with MAOIs. So because of that, they're not given a whole lot, but you still need to be aware of that. So if your patient is on one, you can avoid it or at least monitor for symptoms. So this can be given capsules, lozenges, liquids, or syrups. And I'm giving the antitussive is to stop their cough. It's a cough suppressant. Um, Guaifenesin is an expectorant. Robitussin, that's a common brand of this, Mucinex. So this is given, this is often combined with those decongestants or cough suppressants for treatment of colds, allergies, whatever. The biggest thing with this functions by thinning my secretions so that I can cough it out. Okay, so if my patient is complaining about coughing and I'm giving them this medication, what might they call me and say? Why the heck am I coughing more? Right? Like, what the you are not helping me. So it would be important for me to teach them that the whole function of this is so that they can get rid of that mucus. Okay. So it thins those secretions so that I can use it. So in order for it to work, I need to have them increase their fluid. Okay. So that fluid is helping to break those things up, make it thin enough so that they can cough it out. Side effects of this: GI upset, drowsiness, dizziness, can cause allergic reaction. I want to use caution with narrow angle glaucoma and BPH. And then if this is tablet form, take with full glass of water, but just in general, increase fluid intake. And then um, because it does increase that coughing, that is sometimes why they'll prescribe it with the antitussive, especially if somebody's like severely coughing, having pain, to counteract those things. Mucolytics, um, acetylcysteine is our prototype for this. So this is used most of the time in cystic fibrosis. This is going to for like severe secretions. So this also thins secretions, but this is for more severe. Some adverse effects of this are aspiration or bronchospasm when given orally, hepatotoxicity, so important for me to monitor liver function and then look for those, side effects we talked about earlier. I want to use caution in patients who have hypothyroid, CNS depression, renal or liver disease, seizure disorders, and then if people have asthma. Most of the time, this isn't given to people who have asthma. Okay. It can be given PO, IV, or inhaled. Important teaching with this is that it stinks, smells like rotten eggs. So warning patients of that would be important. And then it is also the antidote for acetaminophen. So if you remember the little first part of that, acetylcysteine, it is if somebody takes or overdoses on Tylenol, this is the antidote for that. And it also can be given prior to heart caths in order to protect their kidneys. All right, decongestants. The prototype for this is phenylephrine, ephedrine, Sudafed. Uh, it's going to relieve that stuffiness. We've already talked about how it works. So I already talked about side effects of this. Make sure that if somebody has cardiovascular disorders, that we're either avoiding this or using cautiously. So monitoring their heart rate, their blood pressure, those sorts of things. Um, so antihistamines, I said before, those first generation, diphenhydramine, promethazine, dimenhydrinate, all of those are going to have those same anticholinergic effects. Okay, so everything's going to be dry. So those medications are Benadryl, Phenergan, and then why can I not think of that one? It's for motion sickness. Dramamine. That's the other one. Okay, so those are antihistamines. Yes, and then the second generation, those have don't have those anticholinergic effects. So these are used for allergic reactions. Again, if histamine is what is causing my reaction, if I'm given antihistamine, it's to block that. Anaphylaxis, motion sickness, and insomnia. I don't think I said this think because we were talking about allergy or like asthma, but if somebody's having an allergic reaction, they're going to get Benadryl also, in addition to epinephrine. Okay. The action of this, I've already said that. It's blocking the histamine. Side effects, especially those first generation, are sedation. Okay. They have the anticholinergic effects, respiratory depression, and local tissue injury. So promethazine, that medication is given for nausea, but they also give this as a combo drug for coughing. It can be used as a cough medicine. If that is administered IV and it is given too fast, it's like very caustic to the veins. So if it's given too fast, it infiltrates, or it's given undiluted, then it can cause tissue injury like in your skin. So have to use very cautiously when administering IV. Um, And then these are commonly, there are over the counter, you can buy combinations of these drugs. All the Tylenol, cold flu, Mucinex, yes, a NyQuil, all of those medications are going to be combinations of those different kinds of drugs. Okay. Um, and then I didn't say that, but on that last slide, it talked about caffeine. So if you look, and probably if you've taken cold medicine over the counter, you might have even noticed like the daytime one, you get energy from it. Sometimes if there is an antihistamine in there, they're giving you caffeine to counteract that, to counteract the sedation that comes from that. Okay. In pediatrics, you just want to make sure that you're using caution when administering those drugs. Make sure that it's only for pediatrics. There are many, many drugs that are weight-based. And so I'm sure all of you have probably read the back of a bottle, a box, whatever, that says don't give to children under 12, or to consult a doctor. So that's why that dosing is probably quadruple the amount that you would give it a kid, even in a very small concentration. Okay, so make sure that it's labeled specifically for children. Another thing to pay attention to, I tried to bring one, I didn't have another one to show you, but when you buy over-the-counter medications, they always come with a dose cup. Make sure that what you're using matches that. Okay, I myself have like lost one before and went to go give something, and it said I needed to give 7.5 milliliters, and all I had was a 20 milliliter, like one mark that said 20 milliliters. You can't guess, and especially for anyone, but you can't guess and especially give that to a kid. Like I said, there's a big range there of what that looks like. So make sure you're using what comes with that. And then if it's not helping them, make sure that you are calling the doctor. All right, a nurse is teaching a client who has a new prescription for diphenhydramine for allergic rhinitis. The nurse should instruct the client to monitor for which of the following manifestations of an adverse effect of this drug. It's select all that apply. A, anticholinergic. Yep. ACD. ACD, right? They got a dry mouth, they're sleepy, and they can't pee. A nurse is teaching a client who has a new prescription for dextromorphan to suppress a cough. The nurse should instruct the client to monitor for which of the following manifestations and adverse effect of this medication. Sedation. Good job. Yes. A patient asks what medication would be most effective in the treatment of seasonal hay fever. The nurse will teach the patient about the use of which drug? Fluticasone. Seasonal hay fever. So yes, prophylaxis. A patient is prescribed codeine as an antitussive. Which symptom will the nurse observe for an adverse effect of this medication? A. Respiratory depression. All right, very good. Fluticasone.